Ajab Khatun, wife of Qaimdeen, 32 years old, belonged to a village called Dari of Tehsil Kandkot, district Kashmir. She had fractured her leg previous week before the floods came and so was unable to move. On the night of August 6th, they were sleeping in their home. Just as the clock struck midnight, they heard panicked voices. They went outside and saw chaos all over. The water had hit their village with surprising speed. The quantity of the flood water was huge, more than their expectations. Qaim, Ajab and their neighbors started moving to higher ground for their safety. Hands started its rescue operations as soon as the news reached at Hands disaster cell in Sakkar. They dispatched their team through boats. Ajab and her husband were rescued by one such team. The boat took them towards a river embankment, the only safe place left. Later in the day, Hands boats initiated the process of bringing tents and cooked food. Soon, a hand pump was also installed and a number of pit latrines established. Qaim and Ajab were satisfied and relieved to see the medical team taking care of pregnant and sick women and children, and a vet doctor vaccinating their livestock. Health and Nutrition Development Society, Hands, is registered. Not-for-profit organization working in social sector since 1979. Hands is providing benefit to more than 13 million population of more than 17,000 villages in 24 districts of Pakistan. Pakistan, a country that is renowned for its fertile lands, rich crops and agriculture diversity, has been ravaged by one of the worst 2010 floods in the history of mankind. Apart from the death toll of nearly more than 2,000 men, women and children, thousands have been injured. Over 20% of the country is submerged underwater. Over 1.5 million acres of agricultural lands and crops have been destroyed. Over 20 million people have been rendered homeless. Of these, over 7 million IDPs have been afflicted in 12 districts of Sindh province alone. Hands immediately declared emergency in the organization. The operation was led by General Manager, who divided the operational area into 3 hubs. The Northern Sindh Hub, based in Sakkar, Southern Hub in Thatta, and the Quetta Hub. Each was looked after by a hub manager. Hands immediately mobilized its 1,264 staff and 10,000 volunteers, along with 40 vehicles, besides deploying 2 boats in each city, that is, Thatta, Kashmir and Jacobabad. A total of 83,163 people were evacuated from the most vulnerable points by the Hands team. Hands had established more than 500 relief camps. We have provided support to more than 35,000 families and 245,000 family members. Hands has supplied in relief and more than 35,000 tons of ration to families. We also supplied nearly 35,000 hygiene kits. The non-food items were also supplied to 35,000 families. Hands ensured adequate water supply and toilet facilities under the most challenging circumstances. Hands Health Team provided health services through more than 3,500 medical mobile camps in 13 districts. Fixed medical camps were also stationed at all relief camps in flood-affected areas that have seen 300,000 patients and conducted more than 5,000 health and hygiene awareness sessions. Around 10,000 women were screened for antenatal and postnatal care. The medical team ensured more than 10,000 safe deliveries and provided with reproductive health kits, comprising of required contraceptives after counseling session. Hands, under its Nari project, provided free-of-cost services through voucher scheme of dozens of health facilities from public and private sector. Hands education program has organized more than 350 temporary camp schools, where more than 9,500 children continue their education in camps. Hence, Agriculture and Livestock Department worked on vaccination, deworming, and provision of fodder for more than 57,000 goats, buffaloes, and bulls. By the grace of Allah and from the help of its partners, Hands has raised nearly 1 billion Pak rupees, that is, $10 million in kind and cash for the rescue and the relief phase. Hands Disaster Management Program started its early recovery plan from December 15, 2011. The residents of the camps started moving back to their village as soon as water recedes through transports provided by Hands. 35,000 families moved back to their homes. Ajab Khatun and Qaimdeen also went back to their village. The scene was shocking for them. Everything had been washed away. Hands staff supported them and assured them for help. Soon the camps were again installed over the debris of their house. Later they were provided with ration and winter kits. Hands research program conducted rapid assessment of the most affected villages and UCs under its rehabilitation plan and selected 16 union councils in 7 districts of Sindh and 1 district of Balochistan by the name of Tameer, the appropriate measure of early recovery and early rehabilitation. Hence, Tameer strategy is focused on family and village holistic development. We have estimated the required funds of rupees 8 billion, that is $100 million for next 3 years. The project will transform 1,000 villages into model villages, 14 union councils and 50,000 families in building their houses. Total cost of a family is $211,000. That is in dollars 2,482. Once the village is selected, Hands team of social mobilization program arrived in the villages to initiate the process of community participation. They gather all the community members and ask the community members to develop a village map on the ground, that is PRA, Participatory Reflection Analysis. They explain to the villagers that they should have a community-based organization to partner with Hands. Later, they facilitate the community members in forming a CBO. The CBO sign a term of partnership. Qaim selected as the men's CBO president and Sahiba as women's CBO president. However, Ajab Khatun was elected as member of women's CBO. The social mobilization team also conducted training of CBOs. CBO also developed a village development plan. The CBO was facilitated to open a joint account with Hands to ensure the transparency and community participation of Tameer implementation. Hands Poverty Alleviation Program engineers assess the village and develop master plan and feasibility. CBO in its meeting identifies the most vulnerable and needy for shelters, entrepreneur, livestock and agri-input beneficiaries. Hands Mobilization and Engineering Team, on the basis of resolution of men and women CBOs, developed the complete proposal and submitted to the Hands District Manager. Once reviewed and verified by District Office, it is then sent to Hands Head Office for approval process. As soon as first installment approves from the Hands Head Office, funds retransfer to CBO account. Soon model village starts taking shape with the arrival of material for shelter, community physical infrastructure, livestock, kits of masons, veterinary workers, carpenters, and other entrepreneurs. Engineers of Poverty Alleviation Program start building a house for each of the deserving and needy. Each shelter costs 110,000 and the beneficiary or CBO contributes at least 10% in cash or in unskilled labor. Shelter is usually of single room, veranda, kitchen, energy-efficient stove, and toilet. Hands also develop street pavements, drainage, water boring, hand pump, and culverts. We also provide livestock to those who have lost it or in need of it. We have provided tools for different entrepreneurs to men and women who had their business before flood. Hands offered seeds, fertilizers, and tools for poor Haris as well. Hands also initiated its health and education program as per need of the villages. Hands Health Promotion Program identifies a community-based women worker called Marvi worker for each village. She is then trained in health service delivery. She develops a corner of her house as Sehat Markaz or health house. She obtains health products like safe delivery kits, contraceptives, ORS, and basic medicines from Hands Sehatmand Social Marketing. Hands also identifies practicing traditional birth attendance. Marvi workers in partnership with TBA takes care of health of women and children with support of their field team. Marvi worker receives stipend from Hands and additionally generates income from the sale of these products. Marvi worker also defines the referral strategy of the village. So in case of complications, women and newborn could be referred to already identified hospitals under the cover of Nari Voucher Project. The voucher scheme therefore bears all the out-of-pocket cost of clients. Hands Education Program also assessed the status of schools. In case of completely damaged school, it provides temporary shelter to continue the education of children. If the engineer's assessment declares it partially damaged school, then the renovation work starts. Hands under the intervention ensures the mobilization of children, provision of learning material, sports item, furniture, repair of toilets, hand washing facilities, and teacher trainings. Hands Education Program also focuses on early childhood intervention from 0 till 8 years old children. Hands also offers adult literacy program to illiterate adults of communities and life skill-based education for youth in secondary schools. Alhamdulillah, Hands has invested more than ₹1 billion in this phase and handed over to owners hundreds of villages, thousands of shelters, entrepreneurs, livestock and infrastructure schemes. Hundreds of Marvi workers are now delivering primary health care services, backed by Nari Voucher Project for hospital referrals. More than 1,000 primary schools have already been rehabilitated. Thousands of teachers and more than 100,000 children are hence mobilized. The flood was the misery for millions, but Hands converted this calamity into blessing of thousands, like Qaim and Ajab. There is a long way to see, all of them to be joyful. Hands is yet to achieve the target of 1,000 model villages. Hands require your generous support to continue these efforts, to make it possible for our dream to come true of Tameer Pakistan, to achieve Hands' vision of healthy, educated and prosperous Pakistan. Millions of Pakistani women, children and survivors are looking forward to you. Let's work together to give them a ray of hope.